Today, the state is also reminding parents to check on their children when it comes to COVID-19 symptoms. Dr. Scrace says in the last 2 weeks, New Mexico has gone from having 7% of our cases being children between the ages of 0 and 19 to 13%. That's almost doubling in 2 weeks, which puts us as the second highest state in the country for the percent of kids who have infections. Wyoming is number 1. To give you some perspective, the U.S. average is 3.2%.
In children, pay particular attention to abdominal symptoms or nausea or vomiting, diarrhea. Those kinds of symptoms are more prominent in kids. If your child has one of those symptoms and a fever, or they've been in contact with someone who's COVID positive, you should assume that your child has a COVID infection and get them tested right away. So it's really important in kids. It's different than in adults, and it's important to get on that early and get the kids tested.
Joy, beyond that, we also heard from Dr. Scrace that we're seeing an understandable drop in immunizations right now because of this pandemic.
Right, Tessa, we're talking about a 20% drop across our state. It's expected, given many of us are avoiding hospitals right now. But the state is encouraging people to get those vaccines so we don't end up with another outbreak.